poker game gone awry. So same as actinomyces, you should know that Nocardia is a gram-positive filamentous branching rod. To remind you of this, we'll use the exact same symbol we used in actinomyces. Literally, we'll take a picture of it and put it above the bar. It's a nice bar painting now. Next, we have a big point of contrast between actinomyces and Nocardia. Nocardia is an obligate aerobe. To help you remember this, we're going to use our recurring obligate aerobe symbol, an air bellow. We've used the same symbol in the Bacillus anthracis video, and we'll use it again in other videos. Don't forget that gas mask in the actinomyces video. Actinomyces is an anaerobe, Nocardia is an aerobe. So Nocardia is found primarily in the soil. To help you remember this, we'll have a cactus pot that was broken during the fight and is now leaking out dirt onto the table. Remember that Nocardia does not form spores, which is opposed to the other bacteria found in soil that we've talked about, like tetany and perfringens, which do form spores. Although Nocardia is considered gram-positive, it actually weakly stains acid-fast. The acid-fast technique of staining uses a carbofuchsin stain, which is taken up when a cell has mycolic acids in its cell wall. Mycolic acids are long-chain fatty acids with two tails. So to help you remember this, we'll have another recurring symbol. It's going to be this cowboy's shawl with chaps. They both have these tassels with two long tails. Again, we chose to use these two branched tassels because they look like the two tails of mycolic acids. So we've covered the mycolic acids, but now we need to remember that they're the reason for the light acid-fast staining. To remember this, we're going to introduce our recurring acid-fast symbol, and you're already seeing part of it. This cowboy is the fastest drawer in the West. He's so fast on the draw, some people say he's acid-fast. Just to make this stand out, we'll color his gun and holster fuchsia. The color fuchsia will help remind you of the carbofuchsin stain used in acid-fast staining. Alright, there are a couple more identifying characteristics we need to cover before moving on. An important feature of Nocardia is that it's catalase positive. So let's add our catalase positive cat being held by the bartender. The reason it's important to know that Nocardia is catalase positive is because patients with chronic granulomatous disease, or CGD, have an increased risk of infection with catalase positive organisms. Alright, and one more identifier to go. Nocardia is urease positive. We'll use our same recurring symbol for urease positive organisms and add our ammonia spray bottle. We'll put this on the bar for the bartender to use to clean the bar, and we'll also make it look old-timey so it really fits this scene. This is the least important thing to remember for Nocardia. We put it in for completeness sake. I can't really see how it could help you with a test question. Urease is more important for other organisms, but maybe you guys can use it as a nice conversation topic for med school parties. I don't know. Okay, well, we're all done with the identifying characteristics. Let's move on to symptoms now. We're going to remember all the symptoms of Nocardia with this other card player at the table. This guy was not as quick as our acid-fast cowboy and already has two bullets coming at him. Let's draw him on the right side and go over the symptoms one by one. First and foremost, you should know that Nocardia primarily affects immunocompromised patients, especially those with impaired cell-mediated immunity. So this means that test writers can give you vague symptoms that sound like a lot of other things, but describe the immunocompromised status of the patients to really clue you into Nocardia. This can include patients with HIV, transplant patients, and patients taking glucocorticoids. So we'll introduce another recurring symbol here to represent immunocompromised, a walking cane. Also, a side note, for some reason Nocardia tends to infect men more than women. Hopefully the title of the story, No Card Game for Old Men, will get your mind thinking more of the infection in men, and the old might additionally make you think of immunocompromised. But in any case, we'll use this walking cane, which signifies a weakened state of immunity. So there are three main sites of infection of Nocardia you need to remember. There's pulmonary, CNS, and cutaneous. Let's start with pulmonary. Pulmonary nocardiosis will usually manifest as a pneumonia with lung abscess formation. We've given you two ways to remember this. First, you'll notice that the cowboy here on the right is coughing to signify pneumonia-like symptoms. Next, we have a bullet here hitting his badge over his chest. Just as the bullet is cavitating the badge over the chest, Nocardia is associated with cavitary lesions in the lungs. Once it's in the lungs, Nocardia can disseminate to pretty much any part of the body. It's worthwhile to know that Nocardia actually has affinity for neural tissue. So nocardiosis can lead to the formation of brain abscesses. To remember this, we'll have a second bullet penetrating the hat of our victim, leaving a hole in it, and this will represent brain abscess formation. Finally, nocardia can also cause cutaneous symptoms. Again, any activity that could cause open wounds to be exposed to dirt can cause cutaneous nocardiosis. Gardening, construction work, carpentry, car accidents. And when it does infect, a pyogenic response usually ensues with the production of indurated lesions. We'll use this cow print on the cowboy over here to remember cutaneous nocardia infection. We'll add redness around the spots to help you remember the inflammatory reaction. Let's finish up with the treatment of nocardiosis. The standard therapy and the answer you should pick on your exam would be sulfonamides. To remember this, we'll introduce our reoccurring symbol for sulfonamides, rotten eggs. We use rotten eggs because they have a foul sulfuric smell. So let's draw an old-fashioned jar of eggs here on the bar to help you remember how to treat nocardia. Remember, this is also a point of contrast with actinomyces. For actinomyces, you'd use a penicillin. For nocardia, a sulfonamide. And that's all for our gram-positive branching rods.